Once again, Dr. Beswick apologizes for not being able to join us for circumstances beyond his control. But I have been working with Dr. Beswick since he was a resident at Stanford, and he was instrumental in launching CORSICA. He remains very integral to the operations of CORSICA and the academic output of CORSICA. He is now an associate professor at UCLA and has built his own team to continue the work of research in silent cancer. And one of his proteges is Sabrina Maoz and Sabrina, right? Sabrina is an MD PhD student at UCLA who has really been doing some really incredible work in this area of quality of life as it relates to sinus cancers. And she's been working with CORSICA since 2020. And this is one of her research projects that has led to presentations at national meetings, in addition to publication. So Sabrina, please take it away.
All right, thank you so much. So good afternoon, everyone. Thank you for taking the time to listen to us telling you more about this research. And I'm excited to share with you some of our findings relating to quality of life of patients with sinonasal malignancy in the 5 years after treatment. So I just want to briefly tell you a bit about myself and how this work has sort of impacted me. So I'm, as Dr. Huang mentioned, a medical student at UCLA. I just finished my PhD in bioengineering and will be applying to otolaryngology residency next year. So I'm looking forward to learning more about how we really can treat these cancers clinically. And this research was presented at the American Rhinological Society at the national meeting last spring, and we were also able to publish this work in spring in a peer-reviewed journal. So as we've been discussing today, sinonasal malignancies are rare cancers with an incidence of 0.5 per 100,000 individuals, so quite rare. And these patients have very poor quality of life. As Cara mentioned, they're often diagnosed at a late stage. And the disease infiltrates important anatomical structures such as the eye socket, brain, nerves, and different arteries. So given its rarity, how sinonasal malignancy and different treatment approaches affect patients' quality of life is poorly understood. Our objective with this project was to identify patient, disease, and treatment characteristics that impact the quality of life in these patients in the long-term 5-year period after treatment. And ultimately, we hope that these results can inform patient-centered discussions of choosing treatment approaches that also prioritize the patient's quality of life and personal goals of care. And again, we've discussed this in multiple talks today, but our approach was to analyze data from adult patients with sinonasal malignancy across the 10 institutions using the CORSICA data, which allowed us to look at quality of life scores that were collected at baseline when disease was initially diagnosed and up to 5 years after treatment was initiated. And we did this using 2 different quality of life scales that Cara already discussed. So the SNUC 22 scale reflects sinonasal quality of life, and the University of Washington quality of life scale describes generalized quality of life. And this scale can be further broken down into 2 subscales describing both physical function, including characteristics such as appearance, swallowing, chewing, speech, taste, just to name a few, as well as social and emotional function with qualities such as pain, recreation, mood, and anxiety, among others. So we used a multivariable modeling approach to identify the top predicting characteristics that impacted patients' quality of life. Our first observation was that quality of life before treatment was low and it improved over time. So just to quickly orient you, for this University of UW-QOL metric, a higher score reflects a better quality of life, and on over time, we're looking at this over time. And so what we find is that over time, these scores improve, suggesting that patients are having better quality of life as time goes on in this 5-year timeframe. So next, we used a multivariable modeling approach and controlled for numerous important variables, things like disease stage that Cara also mentioned, extent of disease, the age of patients, their sex, race, type of cancer, type of treatment, and other variables. And what we found was that worse sinonasal quality of life was associated with a number of variables, one of which is involvement of the pterygopalatine fossa. And so this is an anatomical region in the face that includes important facial nerves and vasculature that is critical for movement, sensation, taste, saliva, and other functions. We also found that worse sinonasal quality of life was associated with radiation to this region, to the sinonasal region. Our next observation was that physical function, quality of life, was associated with a number of variables. Again, the pterygopalatine fossa, this region, was associated with, involvement of this region was associated with worse quality of life. We also found that endoscopic surgery, so this is a minimally invasive approach where long microscopes and surgical tools are used in place of an open resection where you would have to make a large incision to access the sinus. And so we found that endoscopic surgery was associated with better physical quality of life. We also found that dissection of the neck was associated with worse physical quality of life. And our final set of observations was that better social and emotional quality of life was predicted by two variables in particular. So the first was endoscopic surgery, again, this minimally invasive approach, as well as negative margins, which means that after surgical resection, the tissue was sent off to pathology and came back with an indication that all of the cancer was resected. So just to summarize our results and what we're concluding from this study, optimizing quality of life is an important objective beyond oncologic success, as we've been discussing today. And the negative impact on quality of life of variables such as open resection, pterygopalatine fossa involvement, neck dissection, adjuvant radiation, and positive margins can inform counseling and prognostication. We also have ongoing studies that are looking at what factors influence specific categories of quality of life to give us greater detail when we're having these discussions with patients. So I'm going to briefly tell you about that. So our study, one study that we have going on is looking at how these factors affect specific categories of quality of life. And so what we found was endoscopic surgery, which we already know is an important predictor of quality of life, is specifically associated with better quality of life in terms of pain, appearance, and chewing. We also found that involvement of the pterygopalatine fossa is specifically associated with worse quality of life in terms of swallowing, taste, and saliva. So this is just an example of how this work is allowing us to really have nuanced understanding of what variables are affecting different aspects of patients' lives. So I'll take one more brief moment to reflect. This project has personally impacted me in many ways, and it has been really humbling to learn about these patients and their resiliency through each of the phases of this project. It's inspiring to see all these incredible rhinologists who are passionate not only about treating their patients, but collaborating across institutions to create this well-curated database that supports impactful research that can change the direction of this field. And then personally, as an aspiring surgeon and scientist, I really hope to continue asking how to better care for my future patients and improve treatment approaches through my own research. So a huge thank you to the Natalie A. Cole-Reagins Foundation, the resilient and inspiring patients and mentors from across the country. Thanks.
Oh, thank you, Dr. Maoz. That was wonderful. I see we have had a question come in the chat here. Other than gender and age, are there any other characteristics identified in your research for sinonasal patients?
Yeah, so we actually, it really depends on the aspect of quality of life. We also found, similar to Cara, that gender does play a role. Age was actually not so much a factor, which is a very interesting finding for us. We incorporated into the models, but we found that it wasn't a significant predictor. Other demographics that were important, we actually found that most of them were not significant predictors. So we also looked at, for example, race, and that was not a significant predictor. We didn't look as much as Kara's team did into things like industrial experience, but that's something that we hope to do in the future and see what role that plays into different aspects of patients' lives. Thank you so much.